Tri-City Hospital serves the region around Oceanside, Carlsbad and Vista. Its emergency room treated 65,000 people last year, and 2,500 babies were delivered at the hospital.
One of my kids was born there. They did a stand-up job.
But Oceanside resident Brennan Walker says he hasn't yet picked candidates for the board from his ballot to run the publicly owned hospital and healthcare district.
No, I haven't put much thought into that one.
But voters who pay attention to what's happening at their hospital may be concerned. 2 CEOs have been let go by the board in the last 3 years, both under mysterious circumstances and both with generous severance packages. Lawsuits just this year over Medicare billing and a new medical office building threatened to cost the district over $20 million. At a recent forum, one of the 9 candidates running for the board, Frank Gould, sounded the alarm.
I believe that Tri-City is, for all practical purposes, broke, to use the vernacular. I believe that the hospital could be on the path to doomsday if it continues with the incumbents that we have guiding it or misguiding it as they are doing now.
This is not true. We have had 3 years of a clean financial audit.
Incumbent Ramona Fanilla has a different campaign message.
I can tell you, based on my years and years of being here, that this hospital is solid financially. We're going forward with a great plan.
Carlsbad resident Julie Peterson is one voter who gave up trying to make sense of it all.
I had no way of finding out anything about these people, so I actually left off. I didn't even make a choice.
Peterson does not think voters should be asked to choose who runs their hospital.
It should be something that is run by an organization, not the people.
Most healthcare systems in San Diego, Sharp, Scripps, and UCSD, for example, are run by private non-profits, not by publicly elected boards. Healthcare consultant Nathan Kaufman says healthcare is getting more and more complex.
When I work with physicians and represent them with hospitals, they hire me because even they don't understand the business aspects of healthcare.
Kaufman questions whether a publicly elected board can steer the healthcare district through a huge financial hurdle ahead.
The challenge that you have at Tri-Cities is they're going to have to rebuild their facility in order to meet the earthquake requirements, and unfortunately their financial performance is such that it will be difficult for them to raise the money.
But the head of the San Diego Hospital Association, Dimitrios Alexiou, has a more positive take on Tri-City's future, especially because of a recent partnership agreement signed with UCSD.
Healthcare organizations, when they're adding services, adding new equipment, affiliating with other organizations, partnering in the community, those aren't necessarily telltale signs of an organization who's teetering on the brink of bankruptcy or financial distress.
Zach Beck of Oceanside is one voter who shares that optimism.
I do have a good idea of who I'm going to vote for.
Beck believes it's a good thing his hospital is controlled by a publicly elected board.
I do. I think that's going to receive some of the best service possible because the public officials who are elected onto that board are accountable to the people who are receiving the healthcare services directly. So I do believe that's an important thing.
Brennan Walker sums things up this way.
The way it's working now, it works. So until it doesn't work, I think we're all right.
Whoever voters pick to run Tri-City will have to navigate with a steady hand to survive the choppy waters of the changing healthcare system. Alison St. John, KPBS News.